Hello, welcome my wellbeing buddies. My name's Steve, I'm the mental health nurse, and in this session we are going to be covering DID, or dissociative identity disorder. Now, I have worked with quite a few people with DID, and I have to say I have had some of my more colourful experiences as a nurse, and it is a fascinating topic and subject. So we're going to get into this. So we're going to discuss what DID is, what the dissociative identity disorder is. We're going to look at some of those risks. We'll talk about how it's assessed. We'll look at some of the treatment that can be done, and we'll talk about medication for this. So DID stands for dissociative identity disorder, which is a complex and relatively rare disorder. It's also known as previously as multiple personality disorders. And I think the reason it got separated from that, because I have seen DID in full blown action. And sometimes you can see somebody switching from a full person to a completely different person. Where a personality disorder is something about your values and belief systems and what makes us up. You wouldn't necessarily have multiple versions of your own values and beliefs, if that makes sense. It's very complicated. But anyway, DID is about identity disorder. It's like a whole new person up there. And when I've been talking and working with people with DID, they're very open about this to me. I had one particular patient who I worked with who had 12-ish people, and in there, one was a leader, and the way that they got together would be that they would have what's known as a debate through Parliament. So they would all come together and meet and talk about things. And it was fascinating working with that person because they gave me a real insight to DID. And then in primary healthcare, when I was working out in the surgeries, I met some people, and the person that I met who was the most fascinating, they had about 300 different personalities. And when I used to talk to them, they would switch, and that would be from male personalities, female personalities, all ages from adult to children. So an incredibly fascinating topic. And as a practitioner, keeping up, watching for those subtle changes is really key when working with dissociative identity disorders. And equally, understanding how busy their head is and all that conversation going on at one time and trying to get them to quieten that all down so the leader of the head can come forward and take in at that moment. So individuals with DID may experience gaps in memory and all confusion. And that can be because of maybe something to do with dissociation, or because the person that's leading their true born self is lost while the other personalities, the other people are coming forward. So therefore, it can leave gaps. And the other problem with that is that can result into some ongoing trauma. And normally, DID comes from or as a result of trauma through childhood. So it's like a protective part. And I spoke to somebody not that long ago who actually was abused as a child, and therefore this older version came out to protect the younger version. So it's incredibly fascinating and really sad sometimes when you hear about how each person protects the inner person. It gets really fascinating. So looking at DID, each person has their own unique characteristics, their own identity, their own behaviors, and their own memories. Now, when I was talking to this patient not so long ago, we started off in one language and we soon switched into the other. And I asked them, and I said to them, would it be possible to speak to the other person that's supporting you? And this other person came forward, and everything changed. Their expression changed, their body language changed, their tone, their voice, and they had their own value and belief system, which is really important to think about here. So They all had their own names. That got a little bit confusing because those that know me know that I struggle with names. So they had multiple names that made it a bit more difficult, genders and ages. So these identities may or may not be aware that they all exist. And again, there is this sense of loss of time. So dissociative identity disorder then really looks at these multiple people living within one person. So the primary risks here about dissociative identity disorder looks at that piece around trauma and abuse, particularly around childhood. So there is this intense feelings and emotions. So one has to be really careful about trauma-focused care, making sure that we're not going to traumatize the person in front of us. Because if we say something, if we have a trigger, we could lock that person down for a bit and cause a lot of unpaid discomfort. So there is some real problems there. Other risk factors from DID basically means that they could be making impulsive decisions or decisions not based on the person, the original identity, the original person. So that can be a problem. And again, self-medicating to increase substance misuse and or other significant factors around over-sexualized behavior, especially if there is a history there around abuse. So a lot of what we're thinking about here is very much trauma-focused care. So how is DID assessed? How is dissociative identity disorder assessed? Well, it is a comprehensive evaluation, clearly by psychologists and clinical social support teams. So the assessment process looks at a thorough medical history, really detailing, ruling out any other mental health condition that could be associated to things like anxiety, depression, bipolar, schizophrenia, personality disorder, EUPD, the emotional social personality, so lots of stuff there. Then there's going to be a psychiatric evaluation. So in this, the clinician will conduct the evaluation to assess the individual symptoms and to determine whether they meet the DID criteria. So again, talking to those different personalities that might be there. There'll be some level of psychology testing, and that could be through a cognitive functioning test, a personality test, or an emotional awareness state test. Equally, there'll be some kind of clinical interview going on here. So the clinician will conduct an interview with the individual, their families, and they will observe those signs and symptoms. And then overall, they will be observing that behavior, mood, and effect. And if you have got somebody with dissociative identity disorder, it's not difficult to see these changes. They're very, very obvious sometimes. So the DSM-5 criteria for diagnosing of DID includes 2 or more distinct identities. And the person states they must have recurrent gaps in their memory, around personal information, around significant distress, and this then affects their impairment around social, occupational, and daily functioning. So it's important to note that the assessment process for DIS can be complex, and the diagnosis for DID, dissociative identity disorder, should only be made by, obviously, the registered professionals. So if we look at the treatment for DID, so here, obviously what we want to be doing is lots of lifestyle encouraging, eating well, taking your normal vitamin stuff, boosting your Ds, your Bs, your complexes, eating well, lots of information, advice and guidance around alcohol reductions and stuff like that. Therapy-wise, we're going to be looking at cognitive behavior therapy, perhaps, just to see if we can manage some of those thoughts and feelings. We may have to move into dialect behavior therapy. So that's that DBT piece. And that's about keeping people safe, because with DID, there can be quite complex mental health conditions such as self-harming and suicidal ideation. So again, making those agreements there. Because of the trauma piece, EMDR is the evidence-based treatment for therapy. So EMDR is your eye movement and desensitization reprocessing. Every time I get an opportunity to do this, you've seen this now, I can't help it. It just, my arm starts going. So every time you see me do that, you know it's EMDR. So a bit of EMDR may be going there. And equally, They may then need a specialist, so not just a normal psychotherapist, but a specialist trauma focused therapist specialist, because again, it is that piece around trauma which causes this dissociation. Medication-wise, again, there are no necessarily prescribed medications here for this disorder. What we're looking at are the treatment of the symptoms, so the anxiety and the depression and the change in mood. So that could then be SSRIs, so selective serotonin inhibitor uptakes, or it could be mood stabilizers, or it could be antipsychotic medication to manage those symptoms and that level of distress. But again, that will all be decided by the psychiatry team. Equally, what we want under DID is a supportive care network. So under that supportive care network, you're looking at self-help group, lifestyle changes, stress management techniques. So again, look at those videos that we've already done on stress management techniques, because what tends to happen when somebody feels overwhelmed, when somebody feels emotionally unregulated, they can go into their other personalities to protect them, and it almost becomes a coping skill. So it is about working with them to keep them safe. So ultimately, what is DID? It is somebody with two or more people, within them. Risks obviously around substance misuse, risk around self-harm, risk around doing things and saying things whilst not being in control. So again, lots of risks there. How is it assessed? So through clinical assessments, clinical interviews, all through secondary care, through psychiatry, and again, being present more in those locations with a history of childhood and stuff like that, trauma. Treatment for that then, we're going to be thinking about our cognitive behaviour stuff, we're looking at our dialect behaviour, and we're looking at EMDR for techniques. And then finally, medication, we're looking at medication for keeping people well and safe. What I would say in my experience, so working with DID, it is about being non-judgmental, never pushing somebody, never making somebody feel uncomfortable, and never, ever open that can of trauma if you can't put it back. So only open trauma if you've got time, because again, if you start talking to somebody with DID and they let the trauma out, you've got to make sure that you put the trauma back and it's reprocessed and stored safely. So always get a SUD score, a subjective unit of distress score, if you're working with somebody with dissociative identity disorder. You know, how are you feeling today on a scale of 1 to 10? And what does that feel like? And at the end of your session, how are you feeling now? And if you've got a score that's increased or it hasn't gone down, then you may need to do some grounding skills. You may need to do some mindfulness skills. You may need to do some distractions, some visualization, or something to reduce that. So when you finish your session, it's good to go. Anyway, my name's Steve. I'm the mental health nurse, and that was all about DID, dissociative identity disorder. Thanks for watching. Oh, don't forget to subscribe and like.